Happy Friday, everyone. I'm Laura Nwogu, a reporter with the Atlanta Voice, and your host for today. Today's episode is Empowering Women's Health, Take Action, featuring Dr. David Jones, Chief Medical Officer of Anthem BCBS of Georgia, and Dr. Judy Monroe, CEO and President of the CDC Foundation. Our discussion covers insights on how these leaders and their organizations are enabling individuals and communities to meaningfully improve our health through advocacy and action. Dr. Monroe and Dr. Jones, it's so wonderful to have you guys here with us today. I gave a little teaser of what we're talking about, but can you both introduce yourselves and tell us more about your work?
Yes, hi, I'm Judy Monroe. I've been at the CDC Foundation for almost 9 years, and we're an independent nonprofit that helps support CDC as well as health departments and other partners across the country to help improve health.
And I'm glad you're here. So I'm Dr. David Jones. I'm the Chief Medical Officer for Anthem Blue Cross Blue Shield of Georgia, board-certified pediatrician, and have been in clinical care, different leadership roles here in Georgia and healthcare for about 25 years. So glad to be here. So before we get started, I just want to say thank you to Atlanta Voice again for hosting us here for this podcast. And a big thank you to Dr. Monroe for joining us. I mean, this is a real treat to have you here. Thank you for saying yes. And for all of you, maybe you may know Dr. Monroe, you may not, but her careers, she's accomplished so much in her career and impacted healthcare in such positive ways. So it's hard to overstate how excited I am to have you here. So thank you.
Well, thank you, but I'm equally as excited.
Thank you.
Again, we are both so happy to have you both here in the office. To begin, today we are talking about the empowerment and taking action on our health. Tell us about how you and your organizations are enabling this. I don't know who wants to go first, but...
Sure, I can jump in.
Yeah.
So, I mentioned CDC Foundation. One of the things we do at the foundation is because we work with partners, much of our work is done through these large-scale projects. And when it comes to empowerment, one of the things that we do is through communication campaigns. And one that I'm super excited about is actually Hear Me, or Hear Her, I'm sorry. It's Hear Her, a national campaign that started actually in 2020 by CDC, and it really addresses the issue. If you look at maternal mortality or morbidity, the number one thing that we find when you talk to women is that they weren't listened to. They had symptoms that they were concerned about, and folks just blew it off. They just weren't listened to. So it's the Hear Her campaign, and you can learn about this actually. CDC, if you go to the CDC's website, they've got wonderful materials there. The materials include digital as well as they've got print materials. And one of the things I love is there's a quiz. So if you go to the CDC website, you can learn about all the symptoms that you should know about if you're pregnant or postpartum. And that really extends that first year after having a baby. But also, this is directed at friends and partners and health providers to hear her. As this campaign has advanced, an exciting piece is that we're now able, through the CDC Foundation, we're funding 6 community-based organizations, and one of them's here in Atlanta. It's Black ATL, or Black Health. It's Black Health ATL, and Black Health is taking a community approach to helping to empower women and, again, all the folks around them that need to understand these symptoms. And what I love about it is it not only will amplify the voices of the pregnant women and those that are postpartum, but what they're doing is bringing together like community conversations, right? You sit down with the community, you have a conversation about this so that folks really are listening and hearing from them. There are workshops, and they're doing this in conjunction with the Morehouse School of Medicine Center for Maternal Health and Equity. So that's one way that we're empowering health and for women to lean in.
I mean, that's an excellent program and great. And every time I hear about it, I learn more and more. So thank you for sharing that. Just to add to that, you talk about empowerment, and empowerment. There's a lot of things that go into empowerment. some of that is knowledge and information, and also from a trusted voice, especially somebody in your communities. And also it's about being heard, being supported, like being heard, and also being respected. We hear that sometimes in healthcare more than we'd like to, that people feel disrespected at certain points in healthcare. And sometimes that can drive them to not access healthcare and
That's exactly right.
other things down the road. So campaigns like that are so critical, as you mentioned, and also the advocacy for people around them is really important. So, and from my perspective, both as a clinician in 25 years and also at Anthem Blue Cross Blue Shield, we sort of support that empowerment is in a few different ways. One, and also in the maternal health space. One way is through our whole health strategy. We talk about maternal health. A lot of times people think about the time when the woman's pregnant till she's no longer pregnant, right? But it's far beyond that. All the factors that lead to maternal mortality and morbidity, as you well know, are factors that lead up to her life before she was pregnant, right? And so addressing whole health from a physical perspective, behavioral perspective, social driver perspective, all those things are so critical at all stages of life. And so I think in one way it's whole health, but it also has a strong impact on maternal health and empower women in many ways. And then another way, sort of similar to what you mentioned as far as connecting with communities, we supported access to doula services across Georgia in particular.
So important.
It's very important. For those of you who don't know, doulas are such a critical piece of healthcare, especially for maternal health and women who are pregnant or about to be pregnant or postpartum. And they provide great support systems for women around, support for information, education, being heard, things like that. And it's been well documented that having access to doulas can reduce C-section rates, can reduce lower birth rate, reduce premature births, things like that. So really strong resource. And our foundation invested about $1.8 million with the Morehouse School of Medicine's program for doulas and able to expand that by, I think, 60 doulas across Georgia and over 150, I think, lactation nurses. So I think it's really, those are examples of the empowerment, trying to improve outcomes, connecting with the community. I think it's just great services. And so those are some ways where I think
Fabulous
Anthem,
work.
yes.
Yeah, no, I'm really pleased to hear all that.
Great. No, thank you.
Hearing the support systems that you guys have built in your organizations is really great. Q Talk, obviously preventive care and health screenings are critical tools for our health. How are you enhancing access to these foundational aspects of healthcare and also enabling the use of technologies?
Sure, I can jump in again. So, preventive care and health screenings and so forth are critically important, obviously, to health. Our tagline at the CDC Foundation is "Together, our impact is greater," and we really live and breathe that every day. And so, our work through the foundation is through partnerships. So much of how we help folks reach their potential to receiving preventive care services or health screenings is through our partners. So we've, just to give you an example, during the pandemic, we were funding over 300 community-based organizations across the United States. And those community partners, again, driving down to the community and in neighborhoods, they were then helping folks access care. And of course, during the pandemic, folks trying to even get your colonoscopy or get some of your health screenings, your mammogram, and so forth was really, really tough. But so we do our work through those partners. We also work with health departments, and we actually hire a lot of field staff. Yeah. And so some of those field staff are out there helping in their communities or helping the health departments have those things. We've had a number of initiatives, and some of those have actually been here in like Dalton, Georgia. We had a great initiative where we worked with businesses on hypertension and getting the workers to get their screenings done, their blood pressure screenings, and then follow through from there. Cancer screenings, a number of, again, going back to community campaigns and communications is really important to help drive folks. And then I have to say, on the data side, we do that through our funded partners. During the pandemic, particularly, we did a lot of work where partners were creating either developing the apps or developing the technology, a lot of with wearable technologies and things, or they were making sure that they were being accessed by the community. And then I would be remiss if I didn't talk about vaccines, because when we talk about preventive services, I mean, gold standard is vaccines. That is primary prevention. You get that one injection and you can walk away. You don't have to do anything after that. It's not like hypertension where you've got to go back and get the blood pressure, your medicine, that type of thing. And we've done a lot of work in vaccines over the years.
That's wonderful. I mean, thank you for saying that, because it's hard to overstate the importance of that, especially vaccines. So thank you for stating that. So just to build on that, with us, we're much more than a health benefits organization. Really are focused on prevention, improving outcomes. And so as we talked about, there's some things about medicine that are just so foundational. It's important to make sure people have that always. That's the access to care, timely care, the screenings you talked about. So we're doing everything we can to expand access to care, both face-to-face and as well as virtually, and other aspects for physical health as well as behavioral health. That said, technology's changed a lot. We want to make sure we're strengthening the foundations of the access, as well as adding in, let's say, technology that can be value added, that can really optimize people's healthcare experience. So example, our Sydney Health app is one of the apps that we use, and really powerful app in the sense that it really expands people's access to their healthcare beyond just their benefits. They can manage their health both in specific symptoms that they may have, or communicating with their provider, or it can also enable them to be it sort of integrates like telehealth services to providers as well. So use some AI technology around that. So it's a very, and also more specifically, more recently rather, they've added technology where people can search for providers not only by geography or zip code. They're expanding the capability to make it more personalized. For example, you can search for somebody who has a certain training or experience or certain language, or LGBTQ or various things like that. So the idea is to make it more accessible, functional, as well as personalized as well. So it's the foundations we want to solidify in healthcare that we know make a difference, and then building technology on top of that will just sort of enhance that for meet people's needs. So those are some ways we're kind of the old and the new, if you will. They're kind of the critical pieces and adding on to.
But user friendly.
Exactly.
I love that. Yeah.
Exactly.
I love that.
Yes.
And breast cancer awareness is important throughout the year, but we know once we see the pink ribbons, it's October. It is October, which is Breast Cancer Awareness Month. Dr. Monroe, will you talk about your perspective on what is important for people to know and to do when it comes to breast cancer awareness?
Yeah, breast cancer, for me, this is personal like it is for a lot of folks. I actually lost a niece about 18 months ago to breast cancer. It was really it was really heartbreaking. And so early detection, mammograms, that's the number one that folks need to know about. And I'll give a quick story on this. I started my practice as a family doctor in rural Tennessee, and when I first entered into this rural practice in the mountains, women were coming in and all the breast cancer was stage 4 or 3. Wow. All of it was clinically diagnosed. It was the breast mass. Sometimes it was fungating lesions. I mean, I saw some really severe breast cancer. And so that was to be honest, I think it was my starting point for a career in public health, because I was like, whoa, we've got to change this. So I did a lot of partnerships. I brought in resources. We ended up getting a mobile mammography in the county and a lot of communication, because people need to know. So I was on the radio and in the newspapers, and we were telling everybody you've got to get. By my 4th year in practice, every diagnosis was mammography, stage 1 or early detection. Everyone, in a 4-year period, I saw that happen in a county in Tennessee. And so I can't emphasize enough, get your mammograms. Make sure that you're following that. And then know your own risks, right? I mean, women need to know there are some risk factors for breast cancer. And, one of those is alcohol use. If drinking too much alcohol is one of the factors. Your family history. Know your family history. And there may be family history that there's genetics that are predispose you to breast cancer. So talk to your doctor. Make sure you've gotten the screening for that if possible. Lifestyle, exercise matters. matters. Fruits and vegetables matter. We need those antioxidants and so forth that we get in good foods. And then no smoking, because smoking does have some relationship there as well, and obviously to other cancers. So those are the basics that folks need to know.
No, those are some really good tips. As we wrap up today's discussion, can you both please leave us with 3 ways everyone can take action on the health of their family? Dr. Jones, I don't know if you want to start us off.
Well, I'll start with 1 or 2, and I'm sure
Okay.
Judy has many more. So, I mean, as a pediatrician, I think vaccinations, as Judy said, I think that is such a critical piece to maintain or catch up, or what do you have to do? I think it's such a valuable part of our health, and I think it's important to emphasize the importance. And it's our individual health, and it's also the health of our communities. So I think looking at that, it's really critical. So that's one thing I would say.
Yeah, I would say, to all the women out there listening, we're talking about empowering women's health, right? And women drive family health, and whether folks go to the doctor or not. But prioritize yourself is what I'd say. And, that comes back to, getting enough sleep, making sure that you're getting physical activity, your nutrition. A second thing, we've talked about the regular preventive services, making sure that you're getting your screenings, going to your doctor on a regular basis, I think are super important. And the third thing I would say is being proactive. And that is knowing your risk factors. But I really want to, and your family history, but I would hit hard social cohesion and social connectedness. We have a lot of mental health issues in our country, and folks are anxious about a lot of things, so forth. One of the best antidotes is taking action about, I think this was about advocacy too. So you can be an advocate, take on a cause, get with a group, be an advocate, but also just make sure you're not shortchanging your friendships and being involved, because that's just such a great antidote to a lot of the mental illness that we're seeing.
That's powerful. I think it's a great place to leave it.
Yeah, that's a great way to end. I just want to thank you both again for being here with us today. Thank you guys for listening. I hope you took away some ways to take action on your health. And yeah.
Be sure to follow for more at The Atlanta Voice.